waa wareysi aanu la yeelanay Public Health Seattle King County oo ku saabsan faafitaanka jadeecada ee dhawaan ka dilaacay dalka Mareykanka iyo muhiimadda tallaalka.
Hi, I am Deborah Berliner. I am the Communications and Education Lead at the Immunization Program at Public Health Seattle King County. We are here because in 2025, we saw more measles cases in the United States than at any other time since the early 1990s. And that trend has continued this year too, into 2026. And it's not just in the United States, it's in countries throughout the world. So we're talking with people about the importance of vaccination.
Heerarka autismka ayaa ka sarreeya carruurta Soomaaliyeed marka loo eego bulshooyinka kale. Ma suurtagal baa in tallaalka MMR uu sabab u yahay?
It's a really important question. What we do know is that MMR, the measles, mumps, and rubella vaccine, it does not cause autism. In fact, no vaccines cause autism. And here's one reason why I feel very confident stating that. If we look at the Somali community in Minnesota, back 20 years ago in 2006, 9 out of 10 two-year-olds had gotten the MMR vaccine. So almost everybody was protected. Then, starting in 2008, anti-vaccine activists targeted this community and they spread misinformation and fear. And understandably, parents began to feel nervous and doubt the safety of MMR vaccine, and many chose to skip vaccinating their child. And so today, we see that in the Somali community in Minnesota, about 1 in 4 two-year-olds have gotten the MMR vaccine. So we would expect, if there was a link between vaccination and autism, we would expect that as vaccine rates drop, autism rates would also drop. But that is not what we've seen. Despite falling vaccination rates, autism rates are still relatively high. And that's just one example. In fact, dozens of studies all over the world have looked into this question. They've involved millions of children, asking, could there be a link between vaccines and autism? And all of the ethical studies that have been done have reached the same conclusion. There is no link. However, there is a really strong link between MMR vaccine and measles. MMR vaccine is extremely effective. If your child has 2 doses of MMR vaccine, they're very unlikely to get measles, and that protection, it usually lasts a lifetime. So as vaccination rates have dropped in the US and elsewhere in the world, we've seen more measles outbreaks. And this can be really dangerous, especially for young children who may have very serious outcomes like pneumonia, which makes it hard to breathe, inflammation of the brain and spinal cord, blindness, disability, and even death. And, at the end of the day, every parent just wants the best things for our children, right? We are all looking for our children to have the brightest future they can, to reach their full potential. We are looking for them to be safe. By getting them vaccinated, you give your child a better chance at a healthy and safe future.
bulshadeenna waxaa bartilmaameed u noqday dadka ka soo horjeeda tallaalka ama loo yaqaano anti-vaccine activists kuwaas oo faafiya macluumaad cabsi geliyay qoysas badan. Sidee ayaan ku ogaan karnaa cidda la aamini karo marka laga hadlayo badbaadada tallaalka?
If you're feeling confused or frustrated, it makes total sense. The Somali community has been targeted with misinformation and has been discriminated against in this country and continues to be. So it's completely understandable if you don't know who to trust, if you're feeling cautious about what information to listen to. I recommend starting by building a relationship with a trusted healthcare provider, somebody that you can bring your doubts and fears to. That way, if you hear something online or in a conversation, you don't have to sit with that fear alone. You can bring it to your provider who can put the information into context for you. I also recommend looking to trusted organizations. We are so lucky here in King County to have the Somali Health Board and Othello Station Pharmacy. The Somali Health Board has been around since 2012. They are made up of pharmacists, doctors, public health professionals, a range of other people who are deeply connected to the Somali community, know the culture, know the language, and also are keeping an eye on the science. You can trust that they have your best interests in mind. And you can also look to health departments like the Washington State Department of Health, Public Health Seattle King County. I work with Public Health. We have been partnering with the Somali Health Board for almost 10 years on measles education. We look to the Somali Health Board to let us know what the community needs, what questions, concerns they have, and then we provide the information to support their work. And together, we're focused on serving King County communities as best as we can.
Soomaaliya, dad badan ayay cudurrada ku dhici jireen kana badbaadi jiray iyagoo aan tallaal qaadan. Haddaba, muxuu Maraykanku uga duwan yahay?
So part of it may be that measles is endemic in Somalia, meaning it spreads continuously. It's not just isolated cases. So if you've had the experience of having measles, or your parents and your siblings had measles, and you all recovered, you might say, that was mild, that was fine, but that's not the full picture. Alongside those mild cases, there are children, far too many, who experience really serious outcomes. Things like pneumonia, which can make it difficult or impossible to breathe, swelling of the brain or spinal cord, blindness, intellectual disability, long-term disability in other ways, even death. And sometimes you might hear about a child being very sick with one of these conditions, and you might not know that it all started with a measles infection. But this question comes up in every community. For people born in the US, for people born in other countries, I hear often people asking, well, my parents had measles, my grandparents had measles, they were fine, I'm here. Yes, but if you were to go walk around a cemetery in the United States, in Somalia, in any other country, you would see gravestones of children born the same year as my parents, as my grandparents, who didn't make it through childhood, who didn't have the opportunity to have kids or grandkids of their own because of diseases like measles. Now we are so fortunate to live in a time where we can have different expectations of our children's lives. I know that my children are very unlikely to experience diseases like measles, like polio, like whooping cough, because of vaccines.
Halkee ayay qoysaska Soomaaliyeed ee bulshadeenna ka heli karaan tallaalka MMR? Mase lacag la'aan ba?
Let's start with kids. In Washington State, we're so fortunate. All children aged 19 and under can get vaccinated at no cost through a provider that participates in what's called the Childhood Vaccine Program. Your child's provider is probably part of this program already, but if you're not sure, you can go to our website, kingcounty.gov/find-a-clinic. There you'll see a map. You can enter your zip code and find a provider who participates in this program. Most of them require your child to register as a patient, but that's easy to do, and then you can get vaccines and other healthcare services. If you don't have a healthcare provider, there are still so many good options. A fellow station pharmacy. A fellow station pharmacy may be your neighborhood pharmacy if you live in Seattle or South King County, and for good reason. They're fantastic. Folks there, the staff there speak 6 languages. They offer vaccines at no cost to all children ages 3 and up, and also to uninsured adults. Another option, if you live in a school district that has school-based health centers, your child can get vaccines and a range of other healthcare services there at no cost. And the best news is that you don't have to take them to the appointment or pick them up. It just happens while they're at school, so it's a win for everybody. Another option, if you're not registered as a patient already somewhere else, most Health Point clinics and all CMAR clinics will vaccinate all children, even if they're not patients. We always recommend that you call in advance to check about vaccine availability, to see if you need an appointment, but that is another great option. And mobile clinics. These are clinics that happen in your own community, perhaps. You can visit kingcounty.gov/find-a-clinic to see if there are any community-located clinics near you. Now let's talk about adults. For most adults who are insured, pharmacy is a great option, including a fellow station pharmacy. And if you have insurance, you might also check with your healthcare provider to see if they carry MMR vaccine. If you're uninsured, there's a program called the Adult Vaccine Program, and you can find a list of providers and a map at our website, kingcounty.gov/findaclinic. If you would like help finding a healthcare provider, getting health insurance, getting an Orca Lift card, or other services, you can contact the Community Health Access Program. You can give them a call at 1-800-756-5437 or email CHAP @kingcounty.gov.
wixii macluumaad dheeraada fadlan booqo kingcounty.gov find a vaccine ama la xiriir nambarka 1-800-756-5437